Hi, I'm Siobhan from Black Swan First Aid Training. Today I'm putting together this short video to teach you what to do if your baby or child is choking. As a qualified paramedic and mother, I know how important it is to act promptly and correctly if your child chokes on something. And I want you to feel confident in your ability to recognise when your little one is at danger of choking and to know exactly what to do should this happen. Babies and small children are at high risk of choking, partly because they explore the world through their senses. And when they're very little, they try to pop literally everything in their mouth to investigate it. Aside from this, at 4 to 6 months of age, your baby will begin learning to eat solids. This is a wonderful exploration, messy exploration of eating, but it can also be really scary. As your baby learns to master their tongue and to push food around their mouth, they will also from time to time gag. So this is a totally normal and healthy reflex which they use to push the food away from their airway to the front of their mouth so that they can again use their gums and teeth, if baby has teeth at this stage, to break the food down and eat it. They may also cough. So a cough again is a normal healthy reflex which we all have to clear our airway. So we take a breath in and use a forceful expiration to push the food out in baby's case. If your baby's coughing, they may turn red, they may vomit the food up. It's fine to try and scoop the food out to help baby if you feel you need to, but make sure that you can clearly see the food and get your finger around, hook it behind the food and scoop it out of baby's mouth. That you could push the food further back down into baby's airway. We really don't want to do that. The last thing I want to say about this time where baby's learning to eat is that it is important that you stay calm, because while your baby's learning to figure out how to keep the food away from their airway, if they look to you and you've got a face of panic and fear, then baby's going to be very good at reading your non-verbal cues and baby will think that something is wrong. So if baby is gagging or indeed cough, gently reassure bub, or even enthusiastically, cough, cough, you're doing well, you're doing great. Good girl, good boy, cough. If baby can't manage to cough the object up, could be something else, a toy, it's not necessarily going to be food, then absolutely we can call an ambulance. But so long as baby's able to cough, then we don't want to do anything to try and dislodge that object. If we move baby or if we give baby slaps on the back whilst they're coughing, they could suck that object further down and cause it to be a complete obstruction. So that's the first thing. A choke is evidenced by an ineffective cough. So if baby's cough changes and baby starts struggling to breathe, gets distressed and can't take a full breath in, then that's when we need to take action to help. If there's no cough and we can see that baby's choking, so there's no ability to take a breath in, then we need to take action to help. So in these next steps, I'm going to show you what to do if your baby's choking. So what to do if your child is choking? If possible, send for help. If you can alert somebody who's with you or a neighbour to call for an ambulance straight away, then do so. If you're by yourself, then rather you want to take urgent action to manage your baby's airway. Hopefully you won't need an ambulance. To begin with, make a V so that bub's nose and mouth are clear. So you're supporting the neck, protecting the neck, and position bub across your lap, pinching the leg in between your arm so that bub doesn't slip. You can also, for an older baby, support underneath the jaw. We're going to give 5 back slaps using the heel of your hand directed towards your baby's head. You're slapping about where the shoulder blade is, in the middle of the back, just off the spine, alternating between the left and the right side. Pausing after each slap to hopefully have cleared the obstruction, but if you haven't managed to, then you're going to keep going, and after the 5 back slaps you'll need to give 5 chest thrusts. So with these chest thrusts you need a stable surface. The position of the fingers for the chest thrusts need to be in the centre midline of the chest. We're going down 1/3 of the chest depth, pausing after each thrust and giving a total of 5. If that doesn't work, we need to again move to the back slaps, and we're giving 5 back slaps. After that, move to the chest thrusts, and we'll alternate between back slaps and chest thrusts, giving 5 of each, so long as our child is conscious. Now, if your child loses consciousness, then it's important to go to doctors ABCD. We're going to need to do CPR. So to do CPR, again, we're using 30 compressions followed by 2 breaths. I'm going to put together another video which covers CPR for you, but I will say at this stage, make absolutely certain an ambulance is on its way. Golden rule, never start CPR unless you've got an ambulance coming. So you may need to use speakerphone at this stage, or just get on the phone and an operator will be able to talk you through how to perform CPR. At any point, if you manage to clear the obstruction, we can put baby in the recovery position. If you feel you've moved the blockage, you can scoop it out, but don't put your finger in any further than the first knuckle. You can cause a spasm of the vocal cords, which can cause them to snap shut if you put your finger too far down anybody's throat. So instead, that's where we're using the back slaps and the chest thrusts or the CPR to push the blockage up. I hope this video has been informative. Just to summarise, we've gone through how to recognise if your child is choking. We've looked at the difference between gagging and coughing and choking, which is a complete airway obstruction. And we've looked at the steps of what to do if your child is choking. So remember, we've used gravity, we've used 5 back slaps and 5 chest thrusts, and at any time if our child's choking and they lose consciousness, then we're going straight into CPR and following our doctor's ABCD. Thank you for watching. If you'd like more information on what to do in various different emergencies, feel free to follow my channel, Black Swan First Aid Training.